I'm here with Dr. Brian Klepper, who is CEO of the National Business Coalition on Health, and we thank you for your time today.
Thank you for having me.
Well, now tell me, you've been in your post for a year. What have you identified as a real mission for the NBCH?
Well, there's a tremendous amount of waste in healthcare. We talked about that last year. And the mainstream of the healthcare industry is very conventional. They're wed to conventional ways, which continue to make them the money that they're used to making. So one of the things that I've been trying to do, and that we've done at NBCH, is made a point to identify healthcare organizations that do what they do structurally differently and have a track record of getting insanely great results at much, much lower cost, and are credible organizations. So Vidar Jorgensen, the CEO of World Congress, and I talked about it, and we've got a special session at this conference which highlights these organizations, the ones that we found, and hopefully in the future we'll highlight a bunch more.
How did you find them?
Well, so I ask 4 questions of every organization. Because we represent 5,000 employers and unions and local governments, we're a prime target. Everybody wants to get our attention. So I get maybe 10 hits on me a week from different organizations that say that they're the best thing since sliced bread. So I ask them 4 questions. The first thing is, what do you do that's different, that produces a different result? The second one is, show me hard data that demonstrates that you get better health outcomes and or lower cost. The third one is show me testimonials from your clients that attest to the accuracy of the data and that will and that you can execute. And the fourth one is, are you willing to go at financial risk for the results that you claim that you can get for us? And if an organization can do those 4 things, then they're worth looking at.
How many organizations are represented here at this meeting?
Well, there are about 4 who are presenting in the spoken forum, but we've got about 15 that are presenting with posters and whatnot, and all of them had to agree that they can produce reductions in cost of at least 20%, or improvements in quality of greater than 20%, and all of these organizations do.
What impressed you the most about what you're seeing from these organizations?
All of these organizations are mission driven. They have high subject matter expertise in their area. They're all very credible. They're very evidence based and data driven. They represent bright stars in every part of healthcare. They're all different, but they're all held together by that aesthetic, and they all want to change healthcare. Interestingly, most of them are not patronized by the health plans because they would reduce overall revenues for the health plans and reduce overall cost in the system. So the logical thing to do is for an organization of purchaser organizations like mine to patronize them and make them prosperous in their markets, and that will change healthcare.
How do you see these companies coming more in the attention, gaining more attention, if certain health plans or certain companies are looking at them as game changers?
I talk to people in the media all the time, and they are dying to know about organizations that are doing things in a different way and that get a result with much lower cost at much higher quality. There's a lot of evidence. I mean, we cost double what everybody else in the world costs on a per capita basis, and we've got these organizations that are able to do things at half the cost, many of them, of what is normal. So that money is actually recoverable. And that's a big story when it happens, and we've got a lot of big stories that are about to happen.
Okay. When do you think, or we're 5 years into this now, since the Affordable Care Act was passed. What is life today versus what it was 5 years ago?
Well, it's more. There's more availability of coverage than there was. The Affordable Care Act has some good aspects and some bad aspects, but the Affordable Care Act was basically about insurance, not the way that care was delivered or the way it's priced. It was mostly about policy. What we're talking about here with this program, this is in the marketplace, and it's important to remember that that Congress accepted $1.2 billion in campaign contributions from the industry for the industry to get their way with the Affordable Care Act. The industry cannot get its way in the marketplace. The marketplace will be driven by purchasers. So it's a very different thing. The Affordable Care Act is a step forward in a lot of ways, but maybe not in some other ways. So this is really more positive, what we're talking about here.
What do you hope to achieve from what we're seeing today with these companies that you're bringing to the attention of the audience? And are you getting the kind of response that you'd hope for?
Yeah, it turns out that in the session that I didn't think anybody would show up to, because it's the very first session of the conference, we've got a standing room only crowd. And I think that there will be health plans and hospitals and young and entrepreneurs who will go, maybe I should do something that's out of the box like this too, something that really does healthcare right, and not only in care but in cost. I think America is hungry for that right now.
Okay. Is there anything that I've missed that we should
you've
talk
done a
about?
great job.
Okay. All right. Well, thank you so much for your time.
Thank you
today.
for having me. Thank you.